Hi, it's Dr. Sweeney. I'm going to talk about headaches today. Now, the most common type of headache is something called a tension type headache. This usually affects the frontal part of the head. It's quite dull and heavy and achy. It can be linked in with feeling stressed, with being dehydrated. There are no other neurological or nervous system features with it. It can come and go. It's often helped by simple pain relief and hydration. But that's one of the more common types of headaches. Moving on to something called migraine. Most people have heard of migraine. That is more of a vascular type headache, whereby there can be neurological symptoms, often an aura beforehand, blurring in maybe one side of your vision, wiggly lines, flashing lights, dots. Sometimes migraines can even mimic a stroke. They can cause weakness down one side of the body. And migraines can take different forms. There can also be something called a vertiginous migraine, which can be simply a migraine which is linked into causing vertigo, which is dizziness. Another type of headache which we see often in the surgery is a cervicogenic headache. This is when there is impingement of the nerves in the base of the neck, and the nerves actually supply up and over the head, sometimes around and behind the eye, and that can cause a sharp pain, numbness, a tingling over the scalp, in the back of the neck, in and around the eye, behind the eye as well. It can be worse with moving the neck, and that can respond to certain types of neuropathic or nerve painkillers as well. Now, if you are suffering from headaches on a regular basis, it's really important that you check in with your healthcare provider, your doctor, your specialist, to discuss whether things require further investigation. It's always wise to get a blood pressure check, for the back of the eyes to be looked at to check for any signs of raised pressure within the brain. Certainly if your headaches are waking you up in the early hours of the morning, that is a significant red flag symptom that you should definitely go and see about. You may require imaging of the brain just to check that there's nothing else going on there. Now, in terms of headaches, as I said, tension type headaches are usually managed by fluids and simple pain relief. Cervicogenic headaches often by nerve painkillers, and other simple analgesia as well. Migraines, we tend to use preventative treatment which people can take every night, and then also medication which can be taken at the time of a migraine happening. As with all headaches, as I say, it's really important to get things investigated properly. This could sometimes involve blood tests, imaging, etc., to get to the right diagnosis. But if you are in any doubt about whether you should go and see a doctor or a healthcare professional, I would just say always go and get it checked out to be on the safe side. Until next time, thanks.